to hold it real close. Good morning. Thank you for having us here. We are from Eastern, and we're here to talk to you today about some of what we've learned in also having the opportunity to partner with Priority Spokane on a project looking at how to best stabilize families who are experiencing homelessness and work, especially families with young children. And some of what we've taken away from this process, it being the first that we've been able to engage in the Spokane area, has to do with the nature of action-based research and what it means to partner with agencies in the community as scholars with the university. Is that working? There we go. So action-based research basically speaks to this notion of having a very practical problem with which we're trying to address, be it a need in the community, as Dr. Trainer suggested, with trying to improve graduation rates, or in our case, trying to stabilize those families who are experiencing homelessness, and bringing in experts from the university setting to try to provide some background information and some knowledge of the systems that we end up working with and how best to address the needs of those families.
And I think one of the important things about our research, community-based action research, is that as researchers, we rely on community experts for access to data and also for their perspective on what services are available and where are those gaps. I think one of the things that's kind of true about this work is that it's very political. And political in the small p sense, in the sense that we, as researchers looking at an issue, are stepping into an area where there are lots of existing providers, lots of history, lots of turf. And as researchers, our goal is to get an objective view of what's available, what's working, what's not working, what are the gaps, what's working in other places, and how do we apply these models in practice in this context. I think one of the difficulties is that when you're talking about social services specifically, other folks have said this work is inherently moral, in the sense that what social services actually do is often determined as much by the public's perception about the nature of the problem and approaches to solve them as it is by evidence of what actually works. So as researchers studying social services, studying a social phenomenon, studying a social problem, and relying on the community for data and perspective on that problem, we are really having to tread very lightly in terms of presenting new ideas that may or may not be ideas that will work in this community, are favorable in that particular community. And that's really kind of a delicate art, and that's what we're going to talk a little bit about today. So what this has meant for our work, it's being very clear about needing to negotiate and clearly define our goals with our stakeholders, who are the funders, stakeholders being the service providers. We have to be very clear about what our goals are. Are they to identify service capacities and gaps? Who is our targeted population? Are we interested in looking at prevention-oriented strategies? Example, preventing homelessness, or is this about serving the homeless through shelter programs? These seem like easy questions to raise when we're in the classroom. There are certainly things that researchers can think lots about. But when you go out into the community and you begin to do research in these areas and you use community partners, each of these questions becomes highly political. Are we researching the need for prevention as opposed to shelters? Are we talking about a housing first policy that involves moving people from the streets into apartments? Each of these ideas is highly controversial amongst the service providers who are our partners.
And I think I would add to that also the nature of studying homelessness in general. Homelessness itself is a very complex problem that families are facing, especially families with young children who have to grapple with the needs of their children in schools. And we end up working partnering with schools. We work with mental health organizations. We end up working, obviously, with housing and shelters. And so it's oftentimes a mixed bag of organizations that all have a vested interest in a component of addressing the needs of homeless families, but may not potentially have the capacity to address all circumstances surrounding a child's need. And both of us being relatively new to this region, it was also a priority for us to get into the community and to understand not only the stakeholders, but also the various agencies that are working with children on a day-to-day basis, that are working with these families, trying to find ways to alleviate some of their concerns around living in unstable circumstances, and understand the nature of the homeless problem in Spokane itself, which is unique to this region and differs from other areas of the state like Seattle or more rural areas.
Yeah. So one of the roles that we see as faculty members is that we are public educators, especially when we're doing community-based action research. And it's tricky business because there are the traditional town and gown politics. It's important with this to be aware of presenting yourself as an expert, presenting your expertise. Important instead to present, this is what I did, here's the data I collected. I'm
sorry to interrupt. This is something that we're definitely continuously mindful of, the notion of the kind of expertise we bring as scholars versus the kind of expertise that agencies and social service providers have on the ground working day to day with families and with children, be they teachers or otherwise, or shelter providers. And I think part of the difficulty in engaging in this kind of work is to recognize what those agencies bring to the fold in terms of their very nuanced understanding of the day-to-day struggles of these families, and perhaps what we could conceptualize as a more broader approach to understanding the nature of homelessness more generally, and then having to zoom in and understand something about the community at large, the nature of living in Spokane, the lack of affordable housing in this area, the need for more mental health resources, the need for more counselors in schools, to zoom in even closer and to speak with these families and understand the unique needs and challenges that they face in getting their children to school and allowing their children to thrive in environments where there is instability.
So just a few general lessons in navigating sort of that delicate process. It's important to be very transparent about what your goals are, who you are, what you've collected, what you're doing. To include and recognize as many people as possible. One of the things we've realized is that you can present data, but it also is important to talk about every single person that you've included, every single person that you've interviewed. And that is really important in terms of the reception that your research gets.
And to that end, it's also inevitable that we end up missing some component of the issue. Again, homelessness itself is a very complex issue, and so when we talk about the various stakeholders who address those needs for families, inevitably as researchers, there's the opportunity to miss speaking to that one key person or to that one key agency, and so being very mindful of that as you engage in research in the community.
And to share your results and assess potential support along the way. I mean, one of the things I think we've learned is that it's probably not a good strategy to say, here's the research we did, let's present it, here's our strategy, but to present that along the way and to assess the potential for collaboration and support for an emerging set of recommendations. So actually what happens is sort of this iterative process between a recommendation, looking at support, changing the recommendation, looking for the potential support.
At all times addressing the realities of the situation at hand, be they funding or lack of partnership between certain agencies, and always being mindful of seeking out that next step. When our research finished, when we met the requirements of our grant, it wasn't the end for us. We wanted to see those recommendations put into action. And so following up with agencies and being mindful of how to stay abreast of any new concerns that may be arising around, in our circumstance, homeless families in the region, and finding opportunities to keep pushing those initiatives forward to ensure that those families get the services that they best need.
I think the last thing we've sort of learned is that when you're speaking to community, when you're speaking to service providers, data is important, but it's also important to show your data, to pitch your data in a very human context, to say, here's a data set, but this is what this means for the lives of homeless families and their children. Using quotes, using video clips, but presenting this as not a research issue, but as a human issue is incredibly important.
And we definitely see ourselves as the conduit between agencies and families who are living, again, this circumstance on a day-to-day basis and trying to bring those stories forward, especially to the community, perhaps not to the agencies who deal with them, but to the community at large, to understand in our circumstance the nature of homelessness so that the community gets an idea of what that picture looks like, because it's vastly different than a lot of us presume it to be. And so we see our role not only as working in partnership with these agencies, but as being a voice for a lot of these families who lack that voice.
Thank you.